obsessive compulsive disorder, various other functional disorders also can be treated.
So is gamma knife treatment safe?
Question continue.
Sir, I'm reading the question from here, sir. So is gamma knife treatment safe?
See, gamma knife treatment is safe till you select your patients properly. If you are treating a 5-6 centimeter tumor by gamma knife, of course it will not be safe. Patient will develop a lot of brain edema, damage a lot of brain tissue, and the patient will end up in problem. So it is very important to choose the right patient. If the tumor is just because you have the machine, you should not treat the patient on that. So I get a lot of patients for gamma knife, but some of them end up in surgery because the tumor is big.
So how long does the gamma knife procedure take?
So the treatment time typically is between half an hour to 1 hour in most patients. But overall, if you see a patient comes in, we put the frame, will take 10 minutes, MRI takes another 30-40 minutes, planning takes 15 minutes, and then the treatment. So overall, we can finish it off in less than 3 hours. Patient can be in and out of hospital in 3-4 hours.
It's a day care procedure, you don't need a overnight admission.
Thank you, sir.
Sandeep, my question is that if it is just a day care procedure and if we have reports which are conclusive, which really means that patient comes and goes back in just 24 hours?
In 5-6 hours.
Okay. So
I think today a lady came from Punjab and she came to hospital around 10-11. We put the frame and I think by 2 o'clock she was already out.
And any recuperation time?
Nothing. Patient can go back to their work next day.
Next day?
Our softwares are like that. We can do a MRI, fused MRI, seated MRI, and discharge the patient. Everything happening in just a day. Not even 24 hours is too much. We can have many patients in 24 hours. So in a day time, in 9 to 4 times, he's doing surgeries, gamma, coming to OPDs, everything is happening. So this procedure is so precise, so painless. And patient will give you patient will remember you for lives. What they have taken is one and only thing in South Asia, Southeast Asia. So Southeast Asia and South Asia towards different things. So this is one and only functional machine in this part of the continent, and we are proud of that.
Another question, because you said, so can we actually talk about this that you come, it's a daycare procedure, you go back and you can actually join your work or your normal activities?
Absolutely.
Wonderful.
So I treated my own sister a few months ago and she had come from another city and she is a gynecologist and one day later she was doing her own surgeries. So.
Wow. And I'm so sorry that I'm only asking so many questions. If you have questions, please. So you also mentioned that we can treat OCD and all of that. Do we have any references? Have we done something like that? Or
OCD we have got done. We are still waiting for a case. These are functional surgeries, so they are not that common. So we are still waiting whenever the patient comes.
One thing more which all of you seasoned, I also considered all of you as an oncologist. You know gamma, you know neurosurgery procedures, everybody knows what is chemotherapy daycare. So in this part of treatment, you don't have to delay between a normal chemotherapy, immunotherapy and radiation. We always say that complete radiation and then start chemotherapy after a week. This is so precise, the normal brain function is intact. And we can continue in between chemotherapy or we can continue in between gamma knives. So there is no contraindication of giving chemo, immuno and radiation interval between two procedures. That's give advantage to these patients who are traveling and who want to go back on time with the protocol. So we are ready and the system can be done only in daycare without admission.
So I guess almost the other question was, what should a patient expect during the gamma knife procedure? Anything specific?
I think every patient can have their normal meals. They don't have to be empty stomach. They can come. They can, while we are planning the treatment, they can eat their food, listen to music. Even while doing gamma knife, while the treatment is on, we give a choice of music to the patient, and they can listen to whatever they want to. A lot of patients bring their own music and then they listen to that.
Is this actually, it is actually a procedure, it's a surgical procedure. Doesn't seem to be.
But
like
one thing I want to say is that the biggest beauty of Gamma Knife is its software, the planning. Planning in all Linux-based procedures takes several hours. Now the real problem which nobody will talk about comes when, say, and the physicist does that planning. So no radiation oncologist or neurosurgeon will do the planning. Now after 4-5 hours of struggling, if you see the plan and if you don't like the plan, then what do? Do you plan again? Then the treatment is delayed by 1 more day. So you start accepting those plans even if you don't like it. In Gamma Knife, the planning takes just 1 or 2 minutes at the most. If you don't like the plan, you can change it 10 times if you want to in next 10 minutes. So that's where the patient safety, you can assure the patient safety and get a better treatment plan.
Thank you, sir. So the other 3 questions already you answered. One last question from this cohort. That would be: are there any side effects of Gamma Knife?
Yeah, so like any radiation, Gamma Knife can cause injury to the surrounding tissues, which can cause swelling in the brain. But as I said, if you choose the patient correctly, that risk is almost minimal.
Thank you, sir. So now I think I'll hand over the mic to the audience. So anyone, I think Abdul wanted to have, so I'll come to every one of you guys.